inception.
How long have I asked you to do a show like this?
You have been asking me since the inception of Conversations with Kush. What is a fucking cannabis nurse?
No, I'm
What
thrilled.
is a cannabis nurse?
Oh, I have that thumbnail made already. I forgot. Yeah. Great.
What is a cannabis nurse? Yeah, he's been telling me, he's like, have you ever thought about just like sitting down and like saying what it is that you are and what you do? And I was like, yeah, we did that. We did that a little bit, Gabe. We did that at the beginning. But we're on to season 2 now. This is season 2.
You're kidding.
Well,
really?
I mean, in my mind, I have like grouped the episodes and 8 at a time because that's how I pay for them. So this is season 2.
Oh, wow.
And hopefully it just keeps getting better and better.
And today is
an
anniversary.
Well, of
it's
sorts,
August 1st.
I guess.
Oh,
yeah.
Molly's kicking ass, just
February,
to let you guys know.
March, April, May, June, July, August. 6 months, Trisha. Thank you to the day.
That wasn't even the point I was making.
Wow. Okay.
But
well, here we are. It's my 6-month anniversary.
Congratulations.
Yes, thank you very much.
6-month and it's
anniversary and it's
a year legalization.
And a year for legalization.
And when I went live for the first time.
And the first time you went live?
Yes.
On August 1st last year? Okay, cool.
And wow, that's when you went?
I believe so.
Wow, that's really cool.
Mike took me out to a cannabis farm and I did a little video.
The first time I saw you, I was like, who is this girl skipping along? I know she's had some cannabis.
Oh, I'm sure it was completely...
I was like, I wonder if her and I would get along together.
Didn't take long, did it?
No, it did not. No, it did not, my girl. We are like this. We are locked in. Yes, it is.
And just so you guys know, like, we're ready to go whenever you are. So yeah. Oh, and then I just say to the audience, we'd love to get your questions, because we didn't say this to YouTube. So if you want to comment below the video, we'll put your questions on screen, and hopefully we'll ask them.
I think we're looking at Molly mostly.
Yeah, look at me.
Okay. Yeah. Okay, you're not.
Yeah, I know. Look at me.
With those lips like that?
I know, right?
The no drama lipstick?
No drama. Hi, everyone. This is Molly, the Kush RN, and I am joined by 2 really incredible women who I am blessed to call friends and colleagues, Miss Lynn Wackler and Trisha Brown, 2 cannabis nurses that I have been fortunate to meet and collaborate with and get into community with. And so I just want to welcome you both to my show and to my audience. So thank you for being here.
Thank you for having us.
Thank you for having us.
We've been kind of chit-chatting, going along, and really what we've come to for the show is, what is a cannabis nurse? Lynn, let's hear from you.
Yeah, so many things. Cannabis is plant medicine, and when I think about what nurses do and can bring, I really just see, kind of the meeting of best of both worlds, We bring that health background, that knowledge, and then additional training, certification sometimes. Just additional knowledge and training around what the plant can do for the body and how to use it.
Okay.
Yeah.
Let's hear from you, Trisha, because I always have my definition, but I want to hear other nurses' definition of what a cannabis nurse is.
What a cannabis nurse is. Yeah. So I was certified, first of all, a 12-week program through the Integrative Nurse Coach Academy, Candy Nurse Certificate Program. I just want to add that in there.
Nice.
And a cannabis nurse is a nurse who works with clients and finds out what their needs are. And we develop an individualized care plan, and I help educate on the endocannabinoid system. I teach about the 3 main components of that. They learn about plant, the cannabis plant and its constituents, and we develop those care plans, and I help them select the right cultivar or chemovar of that plant that's going to best meet their needs. But it's also involves lifestyle, also recommendations that we co-create together. I can elaborate more on that a little bit later.
Yeah. So basically, we're nurses, right? And nurses work in so many different roles. Like, we have so many tangible skills, right? Like, we're the eyes and the ears of the physician. We are the person that's making calls behind the scene, like to your pharmacy or to your primary care provider if you're in the hospital, or, you know, to your clinic, or we do so many things. And then a cannabis nurse has specialized training in cannabis. So we've sought out either through programs that are out there, education programs, or entrepreneurial programs that have put together a package of education on cannabis to educate ourselves and to go forward and to educate the public and healthcare providers and people that are already using, how they can optimize their cannabis in a therapeutic way. So that's kind of how I define it, right, guys?
Yeah.
Okay.
Absolutely.
How did you come to this, Lynn? Like, what brought you to cannabis nursing?
Yeah, good question. We all have our journey of how we got here,
for
right?
Sure, for sure.
And my journey started, hadn't really thought much about it, but then my son was diagnosed with cancer when he was in his early 20s, and it really, chemo really, like many people, really took a toll. And when he got to his fourth round, he really just hit a wall. And it was kind of too late at that point to get a medical card. And we've got some contacts, like many people do,
Exactly.
who came. All of a sudden, the chemo fairy dropped a nice basket on our door, and I really came to the realization that I really didn't know that much about it, and
Okay.
I was really behind the times. Obviously, some of my patients were using it, but I really didn't understand how it worked in the body.
Sure.
And I saw how effective it was, and what a game changer. And, you know, to have a loved one go from really not being able to, you know, wondering if they're going to finish their chemo to finishing strong,
Sure.
you know, and just kicking butt, you know.
If you don't mind sharing, because I want people to really grasp the scope of what cannabis can do. How did it change his life from day to day?
Yeah, well, he used particularly at night or when the nausea got bad.
Okay.
So, and he used for a short amount of time during chemo. And so he was not one, he didn't stay on cannabis afterwards.
Okay.
He had a limited duration. It's just not his, he might use a little bit here and there, but, and then also for anxiety afterwards. You know,
Okay.
sometimes with cancer survivors, that anxiety, especially around anniversary dates,
Oh, for sure.
boy, that's a real tough one.
Yeah.
And so that's a really another time when he'd maybe take some. But now these kids are also discovering, you know, psilocybin and other ways to, you know, make themselves feel better. So I've been kind of learning about that now too through lots of different people, and just keeping an open mind. And
Yeah. How about you, Trish? How'd you come to cannabis nursing?
Do you want the long story or the short?
Well, I mean, just let us know whatever it is. Yeah.
All right.
Your
so-
version. I want your version.
Okay, so I'm going to just back it up a little bit. First experience?
Sure. Tell me
going
about
too
the first
far
time.
back?
No, tell me about the first time you used
that
cannabis.
Was, I was 13,
Okay.
and I have an older sister. She was not along. I'm not going to name names, but her friends took me out to a place called The Pines.
Okay.
And I tried it then for the first time. I didn't experience any effects, but I wasn't a cigarette smoker either, so
you didn't
I probably
inhale.
truly didn't inhale. And it was years later,
Sure.
as an adult. I have a uncle, who I will not mention names, that brought it camping. So
Okay.
I tried it recreationally. I never had used it medicinally for any
Okay.
purpose. And then in 2013, I tore my labrum in my right hip from an athletic injury training for Grandma's Marathon that I did end up completing.
Nice.
But I was popping a lot of ibuprofen. And we know ibuprofen has a lot of risk factors.
For sure.
Bleeding. I don't want to destroy my kidney.
Right.
And my husband can attest that every day after work, pretty much, after a long shift, that I was also popping ibuprofen.
Yeah.
And
I bet a lot of nurses can relate to that. I know I
right?
certainly can.
Your legs and
Yeah.
muscles, everything's just sore and inflamed. So, I'll get back to that little piece there. But in 2021, I took the nurse coaching program, so that's near and dear to me, and that is on preventative medicine. That's really the objective, and you'll see nurse coaches focusing on a lot of different niches, such as trauma.
Right.
The list goes on and on. But during that time, I was just percolating ideas and things to do, and I just happened to stumble upon the cannabis certificate program, and I thought, wow, that just speaks to me.
Sure.
Because I knew that I had positive effects from cannabis. I just didn't understand it then. And I took the program and my mind just was blown. We have an endocannabinoid system.
Right.
They're not teaching that in nursing school
They sure
or medical
aren't.
schools, or if
Yeah.
they are, there's very few.
Right.
And it's the 12 body system. It's the master regulatory system. So that tied in with my nurse coaching, the preventative side.
Yep.
Because if we take care of ourselves, our endocannabinoid system is going to function a lot better. And the whole point with me saying that is then the less cannabis you need. And as cannabis nurses, we know when we're coaching clients or consulting them, we know to start low and go slow until you reach that sweet spot. So that's how I got into it.
So I'm glad that you brought that up. Couple of things I want to touch on that you said. You talked about being a recreational versus a medical user, and I see no difference in those two things. And you probably do as well. Like, I think once you kind of get into cannabis and start learning about it, you come to understand that when people are using cannabis in a recreational way, they're doing it to treat their own set of symptoms, whatever those might be,
exactly.
right? Whether it be
Yes.
insomnia or anxiety, they just want to feel good, right? Like, that's something that's out there and able for people to access. Another really great point that you bring up is, people always talk about, I ask everyone, what do we need? Everyone's like education, education, education. Well, yes. I mean, did you ever learn in your 5th grade biology class that there's 12 body systems instead of 11? Like, I wonder how many providers even really know that we have a whole system that regulates everything else and brings us back to homeostasis.
Exactly.
So when I talked about, one of our roles, definitely doing that provider education is so needed too. And when we start to have those conversations, that's when we're going to come to the point that cannabis is medicine, and we should be seeing it as that and not as this gateway drug or, an illicit drug that people need to be wary of. Like, I listen to reports sometimes, or I hear things, like, oh, they use cannabis. It's like, that's their medicine.
Exactly.
Hello.
100%.
So yeah, so thank you for bringing that forward and letting the public know that, and that we need to reframe how we think about cannabis. So
It's a plant.
it really is. It really is. Lynn, you came with such a great question. You said, why is cannabis important in traditional healthcare? Why do we need to incorporate that in?
Yeah, I think it just kind of goes back to some of what we were saying. It's, just part of our body system. So once we have more education around this, it'll be less stigma. And I think we can begin to think of it just like we would digoxin or aspirin from the willow tree, or, a lot of pharmaceuticals that have been used have plant history. They've just been, modified by chemical processes. So what I hope we can see as things move forward is more whole plant. So I call it the whole plant, whole person approach. So what I'm really hoping to see as the industry moves forward, and I don't know how this will work with Schedule 3, but I would like to see those components we have of traditional healing where we can use whole plant, and how does that look, and how is that going to be with pharmaceuticals? When you get that full spectrum, all the cannabinoids, all the terpenes, the entourage effect that we always talk about, that's when real medicine is powerful, right? So I'm interested to sort of see how that plays out in medicine and how we can move that forward, right? Because right now providers have really no idea what we're talking about, and that is really a passion of mine too. How do we move the provider education forward?
Yeah.
And what tools do we have to do that?
I hope that we can apply a little pressure from the patient side by educating the patients and the public, and really encouraging people to ask their provider, what do you know about cannabis? Hey, guess what? I'm using cannabis. How is this going to interact with the other medications that I'm taking? Or are you okay with this? Or, different questions, and once those providers start hearing those questions, I hope that prompts them to be like, maybe I should get educated about this. Or my favorite idea is that cannabis nursing, as it develops into a specialty and we become certified, thank you to the ACNA and to the ANA for making that happen. I am forever a heart full of gratitude for you all. As we become certified, then providers will just send their patients to women like us or men like other cannabis nurses that are men, and have us educate patients and guide them down that cannabis journey. That's really my hope. And then I saw today even there was a woman that opened up her own clinic. A nurse practitioner, Lindsay, and I'm sorry, your last name escapes me now, and we are yet to meet, but I'm looking forward to meeting you, and this is the kind of thing that I want to see happening, right? So we're the go-to people about cannabis.
Yeah, it'd be interesting to hear how that works with billing. Could you bill, are things going to be private pay eventually with, could people tap their insurance? Because not always everyone can afford a cash practice. So I wonder if that's possible at some point in the future, if people advocate for that, or how that's going to work.
Well, another piece of it is encouraging people to, tell their provider, hey, I would like you to actually put into my chart that I use cannabis without, detriment. I can't remember what the actual the diagnosis code is for it right now, but once the insurance companies start to see those diagnosis codes, they are going to jump all over that, right? And especially, as you said, with Schedule 3. Now I know one of the big physician groups, and it's escaping me now the name, but they came forward and said we need to just deschedule cannabis.
Oh, interesting.
Yeah. So, hopefully, and I know the ACNA has said that too. So hopefully, more larger groups will come forward and start making this proclamation and just take your hands off of cannabis altogether and free the plant.
Yes.
So, yeah. Tell me some of the ways cannabis has impacted you directly, Lynn.
I would say my own journey.
Yeah.
After working on the front lines and leaving my work, it just was a long road back. I think many nurses who have been on the front lines have struggled with PTSD, burnout, all of those things that COVID times, how it's really impacted us.
Yeah.
And I'm no different. And so when I left my job, I had both a physical injury and have been diagnosed with PTSD. It was really a long road with sort of a multifaceted approach to healing. And honestly, to me, learning and studying has always helped me heal.
Sure.
So just reading and learning, that sort of opened the door to healing for me. And then just being around the plant and people and community, you know, as I got further in my healing journey, being able to just be open about, you know, my own health, my own struggles. And I really did find that using cannabis really does obviously down-regulate the nervous system, right?
Yeah.
I mean, that's why so many people use it. And
Right.
for me in particular, I'm a huge fan of CBD. I have a very active...
Me too.
I have a very active brain, and it just brings that little calm, you know, and just that little extra something, you know, before bed.
Yeah.
And it's really helped me a ton. And there's studies too around CBD use and burnout with nurses
Yeah.
showing real positive effect. So
I am very passionate about helping professionals being able to use cannabis and
Yeah.
psilocybins for that
Yeah.
matter. They help, and they help us especially, you know. One of the things that you said about CBD is I want people to understand is that because I was always under the impression like, oh, CBD doesn't work. Like that stuff's bullshit. Like I think one of the things I really want people to understand, and you can talk more about this too, but you need to kind of view it as more of like a vitamin or a supplement, something that you take on a daily basis. So talk a little bit more about that, Lynn, if you don't mind, about that type of work and what are some of the things CBD can help with?
yeah, so CBD is great. You know, it's powerful anti-inflammatory, vasodilator. So really, besides the, you know, help with anxiety, things like that, it's got those sort of unseen effects in your body working on, you know, as an anti-inflammatory. But it's, yeah, I would say like any kind of medication, there can be, I mean, it's great. You can take one dose, but it really helps when you know, kind of prime your body with over time, you know,
Yes.
like it builds up over time.
Right.
It's kind of running. I always tell people it's running in the background. So
Yes.
a lot of times if you take a dropper full a day or whatever you find your sweet spot is in your dose, it just runs quietly in the background, you know, just helping your systems run smoother, overall feeling better.
Right.
And recently I know we're talking about CBD, but recently I've added a little bit of CBG.
Okay.
The mother, you
Yeah.
know, our mother cannabinoid.
Talk
and
about it. Go into depth about it.
It's
Tell my audience what CBG is
how do
about.
you
Canna
feel
Big
about
Girl.
how do you
Yeah.
feel about CBG?
Say the name again, Trish.
Banana Big Girl.
Yes.
That's a tongue twister. That was
It
a hard
is.
one to say. It's so great, isn't
Yeah,
it?
it is.
Okay, talk about it, guys.
I want to kind of simplify it,
Okay,
if I may.
great. Please do.
So the plant, right, contains all the medicine, the female portion of the plant. Lynn spoke to the entourage effect. THC and CBD, we hear the most about. In general, cannabis helps with pain, inflammation, boosts our immune function. So CBD is a big one on inflammation and immune function. You can take CBD and not get high.
Exactly.
You can work with a cannabis nurse that's going to help you find the right selection for you that fits your needs.
Pause right there because this is, and I always beat this drum like a crazy person, but there's so many uses of cannabis, and there's so many different cannabinoids that you can use that will not get you high. And I think, you know, cannabis has got this big stigma, this bad rap that, oh, that's just for stoners, you know, that's for people that live in their mom's basement eating Hot Pockets all day. So please know that cannabis is very complex and it has a lot of components. And thank you, Trish.
Yeah.
So go ahead.
Well, and we're in the infancy still.
Yes, we
of
are.
All the
Yeah,
knowledge
that's
and
for
research that's coming out on a
Exactly.
daily basis. So,
Right.
but yeah, there's so many cannabinoids. There's terpenes, flavonoids, chlorophyll. It's just an amazing complex plant that
Truly.
when used under the right circumstances or with the right intention we can match it up to fit what the person needs. Because
Yeah.
Lynn and I are going to have different endocannabinoid tones, and you too.
Exactly.
So the plant even might affect each one of us differently.
Right.
And the plant from the same harvest is not going to be the same as the plant on the other side of the same harvest or in the same row, because based on soil conditions and sunlight. So it's kind of tricky when you're in that industry, I suppose, to find the right levels. They have to figure out ranges and.
Right.
But yeah, it's just an amazing plant.
Yeah.
And
What I love is that people get to, and I say this also quite often, develop their own relationship with the plant,
Absolutely.
whatever that may be. You know, if they're looking for something for their inflammation, for their arthritic joints, you know, being able to choose how they use it, like what method of use. So talk a little bit more, Trish, if you wouldn't mind,
Sure.
about different ways people can use
wow.
cannabis.
All right,
Yeah.
well, probably the most common or popular is inhalation. And that
Okay.
could be smoking or vaporizing.
Right.
And they're a little bit different
Okay.
on how,
How so?
well, vaping, dry herb vape, I'll say that's my preferred route.
Yeah, me too.
Because it's the whole flower.
Yeah.
And they make vaporizers that have different temperature settings
Yeah.
that release the cannabinoids and terpenes.
What are some that you've tried that you like?
Oh, strains?
No,
Oh,
vaporizers. Yeah.
The Arizer.
Okay.
We have some friends that have the Volcano,
Okay. Yeah, I've
which
tried
is
the
great
volcano.
social
Yeah.
type of sharing.
Yeah, I've tried the volcano.
Yes, that's really it.
Okay.
I know that the ACNA has a good recommendation. They have I think is it Weejits?
Maybe.
I
Yeah.
believe they have one that actually cools it.
Oh.
So if you are a non-smoker or someone that really doesn't want to smoke, there is that option if you wanted to
Okay.
try it. What's nice about inhalation is the effects the effects come on quickly. The
Right.
onset's quick. But they tends to wear off in 3 to 4 hours.
Right.
That would go to if you combust with lighting on a pipe, and the vaporizing. It doesn't matter. They're both going to be that timeline.
Right.
But it's
So-
really nice for, like I said, quick relief, pain relief, migraine relief, and that's where I qualify as migraines.
Sure. So when you need quick relief, vaporizing or smoking is your best go-to typically.
Yeah. Or sublingual. The
Okay.
tinctures are getting very popular too.
Okay.
And we can talk about that in a different
Let's talk about it
question,
right
but,
now. No, let's talk about it right
well,
now.
Just to say, 50 and up is the highest growing group of consumers.
Okay.
And that's another reason why we need to speak to this, because
Yes.
we're all in that realm.
Yes, we are.
Yeah. And we need to educate the community,
Yeah.
our friends and neighbors, because there are products out there in gas stations.
Right.
And they're not. It's not regulated,
Right.
so you don't know what you're getting.
Okay.
And you hear horror stories. I shouldn't say horror stories because nobody's died from cannabis
Right.
single-handedly, but they have a bad reaction. And whenever
Okay.
somebody has a bad experience, that's the first thing I ask is,
So
where did you get it?
Exactly.
What was the product?
So what I'm hearing from you that it is important to know where your cannabis source is coming from.
Absolutely.
Perfect. And how do you do that?
Okay, you have to have somebody knowledgeable in the field.
Okay.
There are certificate of analysis.
Okay.
And if a product does not have that, I would stay away.
Agreed.
Yep. You can use your phone. There's usually a barcode
And
on
what-
the packaging.
And what will a certificate of analysis tell you?
Okay. It's
Yeah.
going to break down the profile
Okay.
of the cannabis. A big thing, too, would be checking for heavy metals, lead, mercury, also molds, bacteria, toxins. So you don't want to get that into your system.
Right.
So, and there are certain vulnerable populations that are more at risk, that should be more concerned. But overall, in the health and wellness spectrum, I would not be taking anything that doesn't have a COA or doesn't show that it's been tested for those things. But the other things, too, are the terpenes, the percentages of CBD, THC. So there's a lot of information that you can get from the COA.
Okay. Why are the terpenes important?
You know, the terpenes generally produce the effect.
Okay.
Yeah, so limiting is uplifting, kind of that happy. There's linalool that tends to be more sedating and relaxing. Myrcene is also in that category.
Okay.
So yeah, it's important to know. And when we bring that up, because I got asked this question, what's the difference between indica and sativa?
Yeah.
And some people say, well, there's no difference. Well, it depends on the profile.
Okay.
But it isn't a good, accurate way to depict what your product
Right.
is at all. It's
I
misleading.
always tell people when I talk about sativa or indica, think about it as like a classification of like, this is kind of how I want to feel. If I want to be relaxed and sedated kind of and just really kind of chill, that's like more indica leaning. But if I want to be uplifted and have creativity and really, tap into like the tasks and things that I need to get done for the day and be focused, like those are more sativa leaning. But it does all come down to the composition of the cultivar or the
Yes.
chemovar, correct?
Absolutely.
So that is what will break down how much THC a product has, how much CBD or other major or minor cannabinoids are in there, and then the terpenes. And that's really what we want to teach people is that, indica and sativa are really not a thing anymore. Most cannabis that is grown is a hybrid. And you really need to kind of pay attention to what the COA or the certificate of analysis is. If you're looking for a specific thing, especially for therapeutic effects,
Yes.
right?
Yep. The chemical profile.
So yeah,
Excuse me.
thank you. Let's just back up a little bit because we were talking about the different methods of consumption, and we
Yes.
talked about inhalation. We talked about tincture. What are some other? What are the
Edibles.
final? Okay, so
I think edibles, like the women prefer edibles.
yeah.
Edibles are great. They last a long time.
Okay.
But the problem with edibles is it can take 30 minutes to 2 hours before you start to feel the effects. And you hear stories about people taking a few more edibles because they're not
Right.
feeling anything.
Exactly.
And that's not what they want to achieve. So
Exactly.
Generally, the worst case scenario is you fall asleep.
Yeah. And then I know lastly, I'm going to give this one to you, Lynn. What's our last method of consumption? Topicals, which is
Okay,
something
well,
that you really love.
Yes.
So go ahead and take it away, Lynn.
Okay, I love topicals.
Yes, I know you do.
They're my favorite. I gave my 90-year-old aunt some balm for her hip recently,
Yeah.
but okay, I'm probably going to surprise you with this.
Okay,
but
I'm ready.
I'm all about suppositories
Oh,
now.
yes. There we go, too.
Okay, so suppositories. I just read an article, a study about how quick the onset is, and it's
Sure.
right under inhalation. And
Okay.
honestly, that really. Sorry, I'm pounding
No,
on the
no,
table.
you're good.
It's right under. It's right under the inhaled methods for quick relief.
Okay.
And so I've been, just reading about the profound relief from menstrual cramps,
Right.
all kinds of, issues people are, and I think we'll see more. And my thing that I love to do is make things in my kitchen, and you can make a lot of things in your kitchen with some cookbooks.
Yes,
and,
you can.
your shea butter or whatever, your beeswax. And so I love to play around and, with topicals or, eventually I'd love to collab with somebody and see if we can't make a really good suppository for people.
Yeah.
It's good for people with, think of migraines, people are vomiting,
Absolutely.
right? And also, chemo patients,
Yeah.
there's so many good uses. I mean, I used to work peds, right? So rectal Tylenol is always
Yeah.
such a quick way to get relief to a baby.
Right.
And same with
The oral is not always
Yeah.
available.
Right.
Yeah. Yeah, and I just saw today on Instagram someone was using Rick Simpson oil in their belly button for migraine, and I was like, did not read that in any of my textbooks,
I haven't
but
either.
it's to your point of what you said earlier is we often learn from, our patients what they're
Exactly.
doing, and then you go later and you look at, well, can you really do that? Oh, wow, and then you learn. I learned, from having someone going through chemo, but I also learned a lot from my patients. I took care of
Yes.
veterans for a long time.
Yes.
And a lot of our veterans went through just some really hard times, and our Vietnam veterans especially, that era, you
Right.
know, it's kind of, they just intuitively gravitate towards relief in that way.
Absolutely.
And so they taught me a lot about it, you know, and yeah, it's just furthering that knowledge, you know.
Yeah. As far as, methods of consumption, when you think about how vascular the vaginal tract or anal tract or even your mouth is, it makes sense that those things will give you quick relief. I know Megan Bang from Trusted Cannabis Nurse is doing a suppository study now where she's, asking people to use suppositories for like menstrual cramps and endometriosis pain, and she's getting really good results from that.
Yeah,
So
hers look
yeah, yeah.
Very good.
She's really excited about it. So big ups to her for doing that really important work that can give relief to so many people, So, I want to really encourage my audience to think about cannabis in different ways. Like, it's not, this, like I said earlier, some gateway drug that's, it's a big, bad, ugly thing that, people need to shy away from. Like, try to frame your mind around cannabis as a medicine and, just tap into the different ways that it can be used and all the uses for it. Let's talk a little bit about some of those special populations, right? And why having a cannabis nurse is really important when it comes to older people or peds population, or maybe people with mental health issues or cardiac patients. So talk a little bit about why it's important to get a consult from a nurse versus a bud tender or, your friends or family. Lynn, go ahead.
Yeah, so I, in my travels, run into a number of individuals who, went into a smoke shop or vape shop, and I'm talking mature clients in their 70s.
Right.
Tend to see a lot of folks with Parkinson's, mobility issues, post-stroke, different things, and we're given anywhere from 10 to 20 milligrams for a first dose for, just here, try this. And, falls, cannabis affects the balance, and especially in the elderly, you give someone a 10, 15, or 20 milligram edible, I've seen at least between 5 and 10 people who fell. Sure. And then you have a whole lot of conversation around, well, I don't want to try it again, and now I'm scared, and now we've lost a great therapeutic option.
Right.
Because they were given something that was just not appropriate for them. And so that's definitely one thing that I've seen.
Think about metabolism too, how long it takes them to break that down, and how long it remains in the body.
Yeah.
When you get really high, you can get dizzy.
Yeah.
Yeah,
certainly. And once you take
Mm-hmm.
an edible, I always tell people you're committed.
Yeah, exactly.
So I guess the importance of, starting low, going slow.
Yeah.
I can't speak to peds. So I don't have experience.
Same.
Yeah.
And I think so many of the peds patients are being treated with isolates, not full spectrum medicine. So an isolate being something that's derived from the cannabis plant, so singled out and used as a specific medication versus using a whole plant where we're incorporating all of the cannabis cannabinoids and getting the entourage effect that we talked about earlier. So what is the entourage effect, Trish?
Ooh, well, the whole is greater than the sum of its parts.
Okay,
And I
perfect.
spoke to the flower.
Yep.
It has all the medicine.
Yeah.
There are tinctures that are full spectrum, though, too.
Okay.
I'm a little bit biased. I just think that the more we alter the substance, the less beneficial it is, right?
Right.
Overall for our health. So,
Yeah.
what what else was I going to add to that, Miss Molly?
Entourage effect.
The entourage effect.
Yes.
So yeah, they find that there's a synergy with all the plant compounds in there. The synergy.
Love that word. Yeah.
And it works better than the isolates. There are studies out there where they compare pharmaceutical grade, like dronabinol, Marinol, Epidiolex. Those are the pharmaceutical grade products, and they compare the whole plant with it, and the outcomes are better for the patients.
Right.
I'm not going to speak to any particular study. I don't have that
That's okay.
on me, but so the whole plant works better together with the terpenes. Right. So when you pull things out of the plant alone or isolate, and you have to consider or just remember a lot of our pharmaceuticals, like Lynn brought up, are derived from plants. Those are also isolates. And isolates tend to have a bell curve. They don't work so good after so long.
Sure.
And that would be true of a pharmaceutical if you think of it.
Yeah.
I'm not knocking it. There's a place for pharmaceuticals, but when you take those for so long too, they can be harmful. So
Sure.
it's important.
We talked about ibuprofen and, you know, kind of building up and whatnot. Let's talk a little bit about your fabulous businesses, ladies. So why don't you go first, Trish? Tell me what you're doing in this space, and you know, different ways that you can help people and how they can contact you. And
Yeah, absolutely. My business is Centris Health and Wellness Inc. Do you want my email? No, that's on the screen, isn't it?
Gabe will put it up for us.
So first and foremost, I'm a nurse coach.
Okay.
So I provide cannabis consultations, but with my clients, I co-create plans, and we create SMART goals.
Okay.
SMART, measurable, achievable, what's the R again?
Time sensitive.
Time sensitive T. R is realistic.
Okay.
Excuse me. Realistic. So I empower my clients. Everybody has it within them. They have that inner knowing what they need
sure.
to do for health.
Right.
And support is lacking in so many areas in healthcare, and that's why the revolving door, readmissions. So my role is to support my client and help create that vision for them,
Right.
and coach them along with their health goals. Cannabis, to me, is a nudge for that.
Okay.
I can speak to that personally as far as regaining health, but I educate on the endocannabinoid system.
Perfect.
And so they're going to learn about the receptors, the role of that, the enzymes, the plant phytocannabinoids, and how they can help enhance their own endocannabinoid system. That's key. That's part of lifestyle. And what's really neat about the endocannabinoid system, when you learn about it, our lifestyle impacts the function of our endocannabinoid system.
100%.
That's huge.
Right.
And it's important. We have enough research to support the evidence about mainly a whole plant-based diet, how important sleep is,
Right.
rest for recovery, social connections, nutrition. The plant has cannabinoids, but that's not the only plant that has cannabinoids to help us heal and boost our endocannabinoid system.
Spiritual
so there's
care.
Exactly. It's all connected, body, mind, spirit. So
Right.
that, when I coach somebody, is making those connections too,
Okay.
and helping them implement realistic, sustainable health.
Okay. So we all have our ECS, our endocannabinoid system. We all have endogenous cannabinoids in our body. So we all have cannabinoids in our body already. And we can activate those things with good sleep, good nutrition, spiritual health, social connections, all of the exercise, being out in
Sunshine.
nature. Exactly.
Yes.
So we can activate those things, and then we can add phytocannabinoids, which is what we
Exactly.
get from cannabis. And that, you know, if we bolster what we already have, we maybe don't need to have as many added phytocannabinoids. But if our endocannabinoid system is depleted, we can add that phytocannabinoid or that cannabis plant, and it will help restore us back to homeostasis.
Yes,
So getting
beautifully
us
said.
working at our most optimal system go.
Yeah.
Okay?
Well said, Molly. 100%. Yes. Well done.
Awesome. So you kind of, what I hear you saying, and I love this about nurses, because we are the people that empower patients, and this is why we're important, okay? The doctor will tell you, this is what I think you should do. This is what you have. This is why. Maybe sometimes they can come up with a why, not always though, why you have it, and here's what I want you to do for it. The nurse comes in though and says, hey, let's look at these other things. First of all, what's your goal? What's your goal? Is your goal to have restful sleep for 5 nights out of the week or 7 nights out of the week, or improve sleep? Okay, well, what are the things that we need to get you to that goal? So a nurse is always identifying what is the patient's goal, because if the outcome isn't goal driven and coming from the patient, it's not going to work.
Exactly.
It's not going to work. We can't just shove stuff down your throat, including information, including pills, including instructions. We need you to kind of buy in and work with us, and that's why I think nurses are so important in this space, right? And I really want to get that across, and that's how I feel like we need to kind of elevate our profession and show you that nurses are there to partner with you, you know, to take you on this journey with cannabis, and we're informed, and, you know, all the things. So anyway,
Yeah.
that's my whole...
Just to add, because you
Yes,
asked
please
about what
add.
I do. So I would do a holistic assessment.
Okay.
So I wouldn't just assess nutrition and
Sure.
exercise. More, it's a little bit broader than that.
Okay.
But vulnerable populations, the elderly or senior citizens,
Right.
polypharmacy, the
Okay.
fall risk, the dizziness,
Right.
the psychoactivity of THC if they
Right.
choose that route. But another thing with the oral route being very popular, edibles, is that we talked about it takes a while for the effects to come to the onset, and then the effects last longer.
Right.
But when you take an edible, it's broken down to into a stronger metabolite.
Exactly.
So you actually have more psychoactive effects.
Right.
And that's a big one with edibles that I think a lot of people don't understand. It's 11-hydroxy-THC is pretty potent.
Yeah, that's why I see like all these heavy smokers, you know, people that like smoke every day. They're like, oh no, I don't mess around with edibles. And it's like, because it makes a stronger medicine in your body when it breaks down. So yeah.
So yeah, I would do a holistic assessment.
Okay. Assess their medications.
Yep.
Okay.
Medical history, medications is huge.
Okay.
Because we do know that cannabis can interact with some medications.
100%.
What's really cool though is sometimes you can reduce some of those medications,
Yeah,
right?
exactly.
And there are people who have successfully, nurses that we know, that have weaned off pharmaceuticals.
Sure.
But you need guidance. You
Absolutely.
don't want to try that on your own.
Right.
It's a process.
It is. Yeah.
And yeah, I think that's pretty much it.
And I love that you said that, you know, you need guidance. And I think it is also important to mention that, you know, even if you are going to choose this route, and you should be thinking about alternative modalities for your health care, right? Just make sure that your provider is informed. And again, that's another way that we push that envelope. Like, okay, provider, now you need to get educated about what your patient is doing, you know? So I always just recommend that people make sure they tell their provider that they're taking this journey with a nurse. So yeah, I think most providers will be fairly comfortable with that. I hope so anyway. Let's talk a little bit about some of the success stories that you guys have seen. So why don't you start, Lynn?
Oh gosh, so many. You know, I've been out kind of talking to people for the past 3 or 4, I don't know, close to, 4 years now, and I've seen anything from, you know, broken backs using topicals to, you know, just people sleeping for the first time in years. That's always such a great one to see when you hit that sweet spot and someone sleeps and they, you know, call you the next day. They're like, I slept for the first time. And, you know, when we think about health and how foundational sleep is,
Yes.
you know, we talk about diet, exercise, but sleep if you don't have sleep, I mean, it's really, so that is one of the most, I'd say that is probably the most reason why people contact me is, they want something for sleep.
Sure.
And I've seen a lot of great success with that. I'd say anxiety,
Yep.
too. Just a number of musculoskeletal, a big one, just
Yep.
arthritis pain in the elderly.
Oh, for
Give
sure.
them a hand cream and they can, start having some mobility back in their fingers.
Right.
And, of course, we have to say, well, there's all kinds of language and labeling that we need to put on our packaging, right? But with Schedule 3 now, we can say we do have evidence that cannabis, helps
Yeah,
people and works.
exactly.
So, now I don't have to say, well, it's anecdotal,
Right.
and we're seeing more studies come in
Right.
every day. So
And the research will only open up now too.
Yeah.
So pain, insomnia, and anxiety, I think, are the symptoms of these other larger things that we have going on in our body systems, whether it be arthritis or another, autoimmune type disease. So those are the things that people want help with, though, those three things. So when we can address those, talk a little bit about stacking, because I love stacking and I love the topic of stacking and how, because I think this is a real intentional way to use cannabis, and I think it's really something that I hope that from a harm reductive standpoint, I hope that smokers really think about. I always encourage people to, even if they don't like consumables, just give it a try and see if it can reduce the amount that you smoke every day, to just kind of bring that harm reduction down to your lungs. Talk about stacking.
I haven't had a lot of experience with stacking.
Okay.
With my clients.
What is it, first of all?
Isn't it when you're taking maybe an edible and then an inhalation, because edible is basically takes too long to work, so
Yep.
you're using multiple methods or routes of administration.
Exactly. Have you had much work around?
No,
Okay.
I really haven't.
Okay.
What I would mainly, what I do mainly is if somebody's, using a topical, not getting as much relief, maybe try edible or an oil next.
Sure.
Yeah, but I wouldn't say I have a ton of experience.
Okay. Trish, I'm sorry, I didn't mean to cut you off.
Oh,
So
that's okay.
when you're working with patients with Centris, you create a care plan for them, and then do you help them learn how to read COAs and tap into kind of the medicine that's going to work for them, or?
I would tap into the medicine, but not read the COAs to them. I think that's just too over their head at
Okay.
this point.
Okay.
But that is something that I myself would do.
Okay, got
So
you.
I can only practice within the state of Minnesota.
Gotcha.
However, and so if somebody wants to get a product, something that I could do is go to look up the website, check out their product,
Okay.
and look up the COAs. So, and then I can share with them what I found and
Okay.
consult, not make a recommendation, but consult with them and let them know what I think might work best for their given symptom or ailment.
Okay. And then do you work with them over a certain amount of time?
Yes.
Or, okay.
Yes. Ideally, I would like my clients to sign on for the coaching package with the consultation.
Okay.
That's 5 50-minute sessions. So the first one would be going over a lot of the paperwork initially, getting to know, developing a rapport, that therapeutic relationship, and then I may have a recommendation right off the bat. They'll get some paperwork prior to that first introduction, and then we do follow-up, and that will be more learning about the endocannabinoid system, learning how to self-titrate your medicine,
Okay.
and finding out how they're doing on their goal planning and
Okay.
with their plan. Are you meeting your goals? How's your diet going?
Sure.
Sleep? Because that's something that I would be incorporating in it. Usually, like I said, people know what they need to do. I'm not supposed to give advice. That's just not part of what the nurse coach does.
Right.
But I will offer suggestions. But I
Okay.
seek permission for that. But a lot of it's just really getting to know somebody and finding out what their needs are, and keeping in alignment with their values too.
Okay, great. I love that. Talk a little bit more about that.
Oh yeah.
Yeah, yeah.
Well, I would say one benefit of cannabis for me has been re-examining and re-evaluating your life and what's important to you. And
100%.
as a nurse with over 30 years of bedside care, I've held many hands as they're going through their healing process and loss of life, and been with families during that very sacred time. And I really think that cannabis can help people gain deeper insights and understand what's really important to you as in your life. Right. So every day is a different day. I'm on a journey. My path might not be the same as everybody else's, but I'm growing. And I like where I've been and where I'm going with that. I still have a lot of things that I'd like some resolution to. There's family dynamics in every family, and I think the last 6-7 years it's been really hard in our society, a lot of families. And
for sure.
I tell you, I understand the value of family more than ever. And, mine is fractured, but I'm doing my best to have an open and positive relationship with my kids. And with all that said, I guess cannabis has kind of made me reset what's important in my life, and it's helping me find that harmony and balance. Yeah. I'm putting it all together, and it's a roller coaster some days, but I feel like I'm in the flow most of the time, as we talk about, right?
Love that flow state, man.
That's right.
Thank you for saying that. It's not just a medicine that can help you in the here and now, but it can really get down to your soul. I mean, it really can touch your soul. I love cannabis for that exact reason, Lynn, let's hear a little bit about Cirrus Medical and what you're doing in this space.
Yeah, so Cirrus Medical was, it's Roman goddess of agriculture, so named after also after a nurse. So during COVID times, we would take call, and our call schedule was 7 on, and those 7 nights on during COVID times were days I will never forget. They're long. And anyway, so long story short, one of the first patients that I helped pass, because that wasn't normally what I did or what I was trained to do.
Okay.
But that's during COVID times, things changed. Okay. And I trained myself how to do that.
So you were helping people get certified for their medical card, is that?
No. So anyway, so that's how my company got named.
Okay, sorry.
A nurse helped me with my first patient who was passing. And my thought was, when I am at a different time in my life, I want to honor this nurse who helped during... It was a scary time,
Sure it was.
I mean,
yes, it was.
As
Lynn.
Providers, we think, we're trained in all aspects of medicine, but the reality is we're not. We don't know. We don't know everything, and especially if you've never had training, So
no one was prepared for what COVID did to us. Nobody was.
Yeah. So that's how my company really, in between dosing, I just had this dream that I would do something different. And during COVID, when I was on call like that, I couldn't sleep.
Sure.
And so I just spread out these books, and I just started reading one after the next. And so then how my company evolved after I named it was, it just kind of organically kind of grew, just finding products, good products, nurses, that I knew would, does this help your arthritis pain? Does this oil, how do you feel on this oil?
Yeah.
And it was just really great having nurses weigh in and give their feedback of, no, this one we don't like, or this one we love, and so my company has evolved over time. I have my own medically oriented brand. With the laws changing so rapidly and so many times, it's been, you always hear, a cannabis business is a roller coaster ride. It is. It is not for the faint of heart. Because as soon as you get your products all beautifully labeled and packaged,
something changes in the law.
30 milligrams of CBD is not allowed. Now you got to use 25.
Right.
So people don't really think that you've got a whole inventory sitting of doses at this milligram, and then what are you going to do with those now that they're no longer allowed, right? I mean, there's all these nuts and bolts to your company. And then I have a business background as well. I owned a staffing company for a number of years. Nice. And I love nurse entrepreneurship. I'm really passionate about helping, really any woman entrepreneur. I'm sure you guys are so sick of me because I have a great idea.
No, gosh.
What if you did this? And, I just get so enthusiastic because I want to see women be successful.
Yes.
I think that's why we vibe, honestly, because, I'm always saying, like, nurses have all these tangible skills. Like, we're not, you don't have to pigeonhole us. We're not somebody stuck at the bedside. We can do a lot of things. So I love that you have this entrepreneurial heart. It's one of the things that I love about you the most, honestly.
Yeah, and nurses are just starting aesthetic businesses,
right.
And nurse injectors. There's
IV stuff.
IV, I can't remember what they call it, the night after flush that you could have, like
a banana
bag.
Yeah.
A banana bag.
Yeah, it's like you had a little.
We know
too
what
much.
that is.
Those are what you give drunks, people. Just so you know.
Yeah, like you could go to an airport and get an IV flush.
Yeah.
I take issue with those kind of therapies, though.
You do?
Right?
Why?
A little bit, because you're supporting that behavior.
That habit?
Yes.
What if it's just a one-off, though? You really need to feel better.
I think there are more natural ways to get well.
Well, cannabis certainly could help, that's for sure.
Exactly. The brain chemistry is still all off in alcoholics for, I think, up to 18 months.
Yeah.
It's
right?
a long time.
Yeah, I don't doubt it. I mean, I've seen some pretty bad cases of alcoholism come through the emergency department, so yeah, it's bad stuff, for sure.
Yeah, I've lost a number of folks in my life. I've got a couple cousins and friends, and it just, it's not a good illness. Your brain, people don't think that the brain damage is just
brain,
sad.
heart, everything. It's
all
cardiotoxic.
systems. Yeah, it really is. And
Such a toxic substance.
Totally. It's poison. Is
It
what
is.
it is.
we lose so many people a year. It's somewhere around 100,000 a year,
at least.
something like that.
And yet that's elevated and acceptable throughout society, whereas cannabis is looked at as something that's,
this is a hot topic.
bad.
And we see, what is the percentage of commercials on
Right.
alcohol and prescription medication?
For sure.
Do you know that?
Exactly. We haven't even touched on pharmaceuticals yet.
I was just going to say, Ingrezzo, I think that's a medication that's newly prescribed for tardive dyskinesia, which is a side effect from psychotropic medication.
Right.
So take a med to relieve the side effects of another med.
Right. How crazy is that?
Yeah.
How crazy is that?
It's crazy.
Yeah.
And it's just like we just accept it as it is.
We're doing sick care now. We need to stop calling it health care. It's actually sick care. We're not teaching those preventative things that support the
Exactly, yes.
endocannabinoid system, like have a healthy diet, have foods that are accessible to you in your neighborhood that you can afford, like when you go into the grocery store, of course all the fruits and vegetables are the thing that costs the most, right? Like, and like the, Kraft macaroni and cheese that's crappy for you and loaded with forever, what did you call them? Forever chemicals.
Forever chemicals.
That's 99 cents.
Yeah. Well, the ultra-processed foods, we know so much more about ultra-processed foods and these big conglomerates. I've been on my soapbox because I'm really looking at, corporate America and how these giant corporations have really co-opted healthcare, and I call it the commodification of human suffering, right?
For
Everyone's
sure.
profiting off of illness, right? You got the pharmacy benefit management companies, you've got all of these subsidiaries of, and just United Health, just every single one profiting, and but are we really helping our patients, right? So I really hope we're shifting into times where, and cannabis, we touched on this so much, is personalized medicine.
Exactly.
It's really helping patients reclaim their autonomy,
Yes.
right? It's
Yes.
all about you.
Yes.
And that's what I always tell people. Cannabis is all about you. Your dose is not the same as my dose.
Exactly.
And it's a new way of thinking for so many people because medicine really has these patriarchal roots, right? I'm the doctor. I'm telling you what's
Yep.
good for you. Don't question me. Here's your script. I've been in your room for 8 minutes. I'm gone. And cannabis is about saying no more.
Exactly.
Like, we're done. Like, this is a new time and age now. And we're taking back our health. I call it the Take Back Our Health movement. Don't get me started because I'm like...
Get started, Lynn.
I get on a roll and on a soapbox. And I just think of, as nurses who served on the front lines, how long it has taken us to process all of that. And then our patients. And, it's just... There's a lot of suffering in our healthcare system, and it's time to transform healthcare. I know this is a conversation about, cannabis, but it really is. Cannabis is medicine,
Yes,
and
it is.
it's time for transformation. And I want to be part of that larger conversation.
Tell me how you encourage your clients or patients or whatever, people that you encounter, how to have a conversation with their doctor and like what that means, and what do you usually do?
Yeah, I tell people, probably just the same as you guys, just when you're doing your intake, they usually ask, are you taking any drugs? Well, number one, it's
Exactly.
not a drug, but it's important for them to list it as a supplement, right? So it depends on the health system.
Yeah.
Like, where do the person doing the intake, is it listed on supplements? Is it listed on, I'm just not sure how it is today. But I always tell people, make sure you let someone know so they can put it in your chart.
I actually got this question at a panel when I did Lucky Leaf. One of the ladies in the audience was like, well, what do you say when they ask you, like, are you doing any illicit drugs? You say, no, but I do use cannabis, and I think it's medicine. Like, I do use medical cannabis. Whether or not you have a card or not, like, your cannabis is your medicine, and it helps you feel better. And it treats the things that you want treated, like pain, sleep, insomnia, whatever it is, inflammation, So you just need to kind of start normalizing that discussion. Like, cannabis isn't a drug to me. It's my medicine. It's what makes me feel better. So,
taking away the shame.
Exactly.
We've been programmed to feel shame around cannabis, and it really is going to take I think some time before it's not like that. We've lost a whole generation of physicians that it was part of our pharmacopoeia and carried around and just prescribed since Queen Victoria, and it was just a natural part of practice. And then it was just really demonized, and it's a shame. So we've lost that generation of physicians who, and I say physicians because that's who was practicing at that time, along with traditional healers. But they've kind of lost that sacred knowledge, traditional knowledge around the plant. So now we have to go back and not only teach them the pathophysiology and around the whole endocannabinoid system, but we also the plant. I've learned so much about the plant from the Ganjier community.
Same.
Yeah, and then we have to also work with the shame, the stigma. So we're really
It's
we've
a
got a lot
big
of work.
battle.
We've got a lot of work to do in front of
Yeah.
us, and we just do it, one day at a time, one patient at a time, one
Educate.
encounter at a time.
One encounter, exactly. Yeah. That's what, when I hear those, they're using cannabis, I try to take those opportunities to be like, that's their medicine and that's what's working for them, just to kind of just bring it down to a little. And people are always just kind of like taken aback a little bit. And I'm like, oh, whatever. I don't care if you are uncomfortable with my wording or, me challenging what you're saying. Like, this needs to be challenged. This needs to be challenged. Right?
And I will say that it seems like the people in my, that I'm networking, connecting with, especially if they're providers, physicians, other providers, and my phone will ring, my wife's got breast cancer, what do you have?
Exactly.
And it's just, I'm a safe space to land, and they know that I've got something that can, potentially help them, and then it's like you said, what symptom, what are we working with, what is it, the sleep, the anxiety, and then we can sort of give a couple of things to try. But it's like, there's so much stigma until you need it, right?
Exactly.
And then it's like, oh, what do I do now?
People come to cannabis when they're desperate because nothing else is working, and I'm just saying, get there a little sooner, people. That's all.
Yeah.
Hey, Molly.
Yeah.
I'm sorry to break in, but we have a lot of questions from individuals, and I just hate to miss them, I guess.
Well, they're
'Cause
going to
we're
have
over
to
an
wait a
hour.
second because
Okay.
I want to talk to Lynn about her product.
Of course. Okay.
So if you could
Just let me know.
pull up her website a bit, please, and let's talk about this little product. You have this product that you have that I fucking love.
Which one is it?
It is it comes in the pump. It's cinnamon flavored.
Passion.
Yes,
I
passion.
have that one too.
Oh, you have it too? Yeah.
Let's talk about sex, people.
Let's
just
talk
say it.
about
It's
sex,
It's
baby.
a human body,
Let's talk
right?
about you and me.
Oh my gosh.
Yeah.
All right. So this is Lynn's website, you're saying?
Yes, please.
Okay. Okay. One moment.
So where did the inspiration come for that, Lynn?
I think it was around Valentine's Day.
Nice.
And I just, had always wanted to create that and had been, kind of formulating recipes in my kitchen. And then I found somebody who had something very similar to what I was making.
Okay.
And it's a, vasodilator. So
Yeah.
it's going to,
I love your product because it is for women of a certain age. I feel like mostly, it helps with lubrication and it tastes good and it enhances those times when you might need a little enhancement. It brings something extra to the bedroom to spice it up a bit, and it's cinnamon flavored, so of course it's spicy and
It tingles.
It tingles, yeah.
I don't know what is going
Edible.
on, but when I put that website in, it brings up. Is this it?
yeah.
It is. Okay. Sorry, it actually says like a different name at the top. So just making
Cirrus
sure.
Medical, a
Yeah,
whole
that's
life-
me.
No, on
this
mine
is-
it says
Lynn's beautiful.
It says
This is-
African American whatever chef shell whatever.
Oh,
So it's okay though. If this is it,
Okay.
we're good.
What is it?
yeah. So, go to the shop page and we can see what we're talking about there. What other products do you have, Lynn?
I've got my roll-on gel. That's like my favorite.
Feel free to guide me through it too.
Yeah. So great. I've got a balm, hand balm. I'm reformulating some things now based on dosing. So,
Okay.
and then you see like some of our great partners' products up there.
Balanced, mini-grown.
just mini grown, and
Yeah.
some of our tried and true favorites.
For sure. I
yeah.
love that you're highlighting Minnesota products
Yes.
too and really
Yeah.
putting them forward. I think
Yeah.
that's important.
And they have been so great to work with.
Yeah.
All of these companies are so responsive and just so great. And so I'm using just a variety of their products. It's difficult when you make a line of products.
Yes.
You can't make everything, especially
No.
on one tiny shop, so you sort of have your area of expertise and then and branch out from there.
Just another great nod to, though, what nurses can do. Yes, we are product innovators. So
I've never seen a hard candy for THC or whatever, for Delta 7 or 9, I think is what you had up here.
Oh, really?
Yeah, how does that? Oh, okay. Is that news?
Some low dose, microdose on there, 2 milligrams. They're 2 and 2, 2 CBD and 2 THC. Those are from Nothing But Hemp, and they're great.
Okay.
Yeah, a lot of folks start with those, and they're more, I would say, sedating. So those are really great. We have helped a lot of people with those.
Awesome.
Yeah.
I love to see the ratio products up there. So a mix of THC and CBD. I think those are really important.
We didn't talk much about ratios.
Talk about it.
So ratios are, so you might have say a 1-to-1 ratio, and 1-to-1 ratio tends to be a sweet spot, especially for patients struggling with cancer. We have Sativex, which is a prescription drug and used in Canada. So that's a really nice balance. But then, so especially...
What does it mean? Just kind of piece it out for the audience that might not grasp onto that aren't nurses. So it would be like 10 milligrams of THC with 10 milligrams of CBD, so that you're getting both of the medications at one time.
Yeah.
And how would that affect a person's body?
So,
like, let's say they're using it for sleep.
Yeah, so I would, let's see, the best way to explain it, if folks aren't real familiar with ratios, the CBD, when you combine it with THC, is acting as a buffer, right?
Perfect.
So you're sort of mitigating the effects of THC. You're dialing the THC back when you add CBD. And so you can do that with ratios. So a lot of times with a mature patient who has never used before, I'll use that 1-to-1 ratio, or my sweet spot that I love is like a 1-to-5 ratio. Okay. So you might see like a 5 milligram. In our state, we have statutes with limits of the cannabinoids. So one ratio that I love is like a 5 milligram of THC and a 25 of CBD.
Perfect.
So that they're not... it's just a nice entry point. And then I might even break that in half. So for somebody who's never used, my kind of go-tos are those 2 milligrams or a half of a 525.
I have said over and over again that Molly's medicine is my medicine of choice, and her medicine is a ratio medicine. And what I love about it is that sometimes THC, if I have too much of it, makes me a little paranoid. So to add in that CBD, it kind of smooths things out for me. It makes me not be so paranoid and kind of helps me relax a little bit through that THC. So I'm still getting the benefit of the THC, but the CBD just makes it nice and smooth for me. So that's kind of how I liken it.
Yeah, not everyone can sleep on THC, I found.
True.
Too. So,
some people need it for the pain, though.
Yeah,
you know.
Yeah, it's that, like you said, the really coaching and sort of trying. Well, maybe we'll try some CBN, right?
Exactly.
And then that's such a great cannabinoid too.
Yes.
So I use a lot of CBN with folks. I think you saw the Hibernate on there.
Yeah.
That's just a great cannabinoid. So,
True.
And we see that a lot of times. We'll see THC, CBN, and CBD, but some people, it just depends. You really have to get to know the person. You to really try a few different things, and you rarely get it right on the first time.
Yeah,
is what I will say.
And that's why it's good to work with a nurse. You're establishing a relationship with someone that you can trust. That you know is not going to steer you in a wrong direction. It's not trying to sell you the most expensive product in the dispensary. That can really kind of tune into like exactly what you need, like get you as close to what you need as possible, versus like trying 100 things before you get to the thing where you need to be. So I think these are all important things, right?
And we help reduce that risk of adverse effects.
Exactly. Exactly. By looking at meds, by, you know, considering the special populations of age or metabolism or, you know, health issues or whatever they may be. So, yeah. You guys ready to take some questions? These guys
Let's
are
do it.
chomping at the bit. Let's go, audience. What you got for us?
Let me just preface this to you. So a lot of them, the YouTube questions, for whatever reason, aren't coming. So I'll have to read those to you. So I've got them.
Okay.
But I'll start with the Facebook ones.
Okay, great.
All right. So here we go.
I'm excited. What needs to happen in terms of legislation in Minnesota in regards to cannabis? Are our laws holding anything back? It's a great question.
And that's from Wrong About Everything podcast too,
Oh, okay.
Wow.
Wrong about everything. Okay.
which is a big political podcast.
It is
so
a
that's
big
it.
political
Yeah.
podcast. Thank you.
Wow.
Gosh.
It must be Javier.
We need
Needs to happen.
Tanner here.
Yeah. Well, there's so much to that question, right? In terms of what are we talking about? Are we talking about dosing? Are we talking about
Getting
testing? Are we talking about
dispensaries opening.
time?
What do you guys see as the
One
biggest
of-
limitation?
So one of
Or
the I'll
whatever.
say what I think.
Yeah.
Okay. Because one of the things that I think should be happening when like dispos go live and whatnot, like if people are going to be doing medical cannabis through their dispensary, I think that patients coming in that are brand new to the medical program need to have a consultation by a a licensed medical provider. So whether that be a pharmacist, a nurse, a doctor, a nurse practitioner, a PA, someone that holds a license. Now, some of my colleagues don't necessarily agree with that, and other nurses. One nurse that I know has given up her license. She's not practicing as a nurse anymore, but like she's got all this cannabis knowledge, right? So I think even amongst us, there's some discord between my opinion and maybe what some of the other opinions are. But I think if you're accessing the medical program, even the caregivers program, I think that you need to have a consult from someone that holds a medical license in some form or fashion. That's just my opinion on it. So I don't know.
I do agree with you, Molly.
Yeah.
It's a harm reduction approach. Safety. We have to protect the public. So-
Absolutely.
and it's the medical. Recreationally, that's different, the recreational side.
Yeah, if you're accessing your cannabis and to use it in a therapeutic or a medical way, then I think you need to have some guidance from a medical provider. So that's my opinion. I know it's not always a real popular one, but that's where I stand on it. So,
So yeah, this is from the same show. So do you see many doctors still treating cannabis like it's an illicit drug? Wrong about everything.
100%.
We're
100%.
working
Yeah.
addiction
Really?
health.
100%.
It's common?
Yeah. I feel like it's always kind of just like this, like, oh, they're smoking. Or like one thing that you hear all the time is like when patients come in, they'll be like, oh, they reek like weed. So what?
I'm shocked,
Smells
actually.
good.
Yeah,
smell
I was like,
kitchen
oh, they
growing up.
smell good. Exactly. Right? Like, oh, shit,
Yeah.
what were they smoking?
Do you guys ever feel like
Let me
you're
go down
at?
to that room real quick.
Do you guys ever feel like do you ever kind of get in debates with these doctors? Like I'm actually blown away that doctors still
Yeah.
you can't
not-
really
it's
yeah.
not
worth
worth
it.
it.
It's
Right.
not worth
No.
it, right?
No,
Yeah.
we're spreading love.
Yeah,
you know?
exactly.
No,
It's
no.
not worth it. You're not going to change anyone's mind in the moment like that anyway.
no.
You need to kind of be like, hey, let's talk offline about it. I know a lot about cannabis. I'd really love to help educate you and get you to a place where you might feel more comfortable with it, you know? So,
Well then, so this is a question I wrote off of it says me, but it was from YouTube, and I think it's a good one then. So have you ever seen a prescription legitimately backfire or worsen the situation for marijuana? Or for cannabis.
there's
I
no
have
one's
not.
no one's going to write a prescription for cannabis really either. I mean, they can certify you to get a card, but like there's no prescription. That's why working with a nurse or, you know, with the medical dispensary is a good idea if you're going to titrate your dose. Like you ultimately are the person that gets to decide how much cannabis you need and what type and what works for you. So
In the medical
there's no also I just want to say this, there is no lethal dose of cannabis, so you cannot die from cannabis alone. Trish alluded to this already. And I think that's where we get confused about, you know, when we think about alcohol too, like you can certainly die from alcohol easily, but you can't die from cannabis. The worst thing that's going to happen to you is you're going to need to go lay down and take a nap and probably eat a big meal. Like,
In contrast, too much of a pharmaceutical, that's probably going to kill you. Many of
you're
them,
gonna
even
end up in
over-the-counter
the ER
supplements.
on somebody's cardiac floor for a week.
Yeah.
You know, getting your Benadryl
Yeah.
out of your
ridiculous.
system. Yeah, or your opioids. Yeah, for sure. I'm sorry, Lynn. I didn't mean to cut you off. Tell me what you're going to say.
Oh, I was going to ask in the medical program,
Yeah.
when the pharmacists dose, are they considered to be prescribing, or are they, what vernacular, what term
Yeah.
are they using? Are they using prescribing, or are they using dosing?
I was
Great
going to ask the same
question.
thing.
Great
Yeah,
question.
to clarify that.
Yeah.
Well, it definitely is, in our state, is very unique. I don't know another state where the pharmacists, I always call it dosing.
Okay.
You know, and the folks that I've worked with, they call it prescribing. The
Okay.
pharmacist prescribed this to me.
Sure.
So I'm not exactly sure because I'm not
Yeah.
a, medical
Me
patient.
neither. We need Andrea from Green Goods to get
Yeah.
call up. Andrea, where are you at?
Yeah.
We need you.
Prescribe.
So, I mean, I can ask this question, or just to go, because I'm actually extremely confused on this, I guess. So you're saying that we have all these dispensaries and all this, but we don't have a medical marijuana card here.
Yes, we do.
Yeah.
We do.
Yeah.
Okay, then what? Okay,
Oh,
I guess I'm more
speaking-
confused now.
Speaking to the point of that last question too, so the laws have changed this past legislative session, where now it used to be where you had to be have special training to certify a person in getting their card. Now any provider in the state of Minnesota can give someone a medical cannabis card, and it can be for any condition. So there used to be a host of conditions that you could choose from, or whatever you had. And now you can say, hey, I've got this eczema on my elbow and cannabis works for it, so I need my medical card. And your primary doctor, whoever that is, can give that to you. So
Well, okay.
Wide open.
it's
so-
wide open.
I'm wondering if they really know then what is the process and what's the next step. This is what I was hoping to learn from the Office of Cannabis Management.
Yeah.
I really want to dial in on what does that look like in clinical practice? Because
Sure.
I can just see
Yeah.
a patient coming in and saying, okay, I know you can do this because the cannabis community told me you could.
Right.
And I could see the providers going, I don't know what to do.
Sure.
Like, who do I call? And
Yeah.
so I will be figuring that out.
Okay,
So,
great. Stay tuned, audience.
Yeah.
Lynn's going to educate.
Lynn's
I
on
will-
it.
I will figure it out.
So this question's actually mine, and it's kind of I was curious about this, because how cannabis has been great for me is truly just restoring this joy and fun, to giggle, I don't know, to have fun in a way that I did when I was 20 or whatever. And I'm like, but can you go get a prescription for that, or go get your card for that? You know what I mean?
Laughter is medicine.
I better just make up something.
We can find a way around
try
I got
it.
some
for
eczema.
sure.
Yeah,
you
I was
can
just
certainly-
curious.
You can certainly try it.
It's so dumb though that they don't, because that's a legitimate thing to me. I don't know.
Yeah,
it is.
It's been,
Well, and that's what I always say about the recreational users. Even if you're using it to get high and just feel good, there's nothing wrong with that.
Yeah. I'd
Right?
want to know how you were feeling before that.
just
Yeah,
that
exactly.
I can tell you exactly. I feel like that I don't have access to that. It's like you're stuck in the seriousness of life. You're heavier. You're not it's like you're focused as an adult.
Yep.
And it's nice to be able to truly unwind and just enjoy myself. And then I feel like the next day that there's even sort of an overall reduction in my anxiety, an afterglow, I guess.
Aww.
Is there any medical
Absolutely.
whatever to that?
Yeah.
You
Or-
just tell them you want to work on healing your inner child and you'd like a prescription or like a recommendation. And, we all know what healing the inner child is.
I think
Stress.
Exactly.
Stress.
I was just going to say that stress tension cycle too. I'm not an everyday cannabis user, but I can tell when I haven't used it for a few days, I'm like, I need to smoke a joint. Because
you had to restore
I'm-
your balance.
Exactly. I'm more pent up. I'm a little bit more irritable. I'm, flying off the handle maybe, having a Karen moment at
How
home.
does it actually help anxiety medically? What does it do to your body?
Well, CBD is a great just mood elevator and helps with anxiety and depression. I won't get too much into the pharmacokinetics and the
Okay,
other part. But, I mean, it affects your CB2 receptors a lot like your 2-AG, your own endocannabinoid. So
The
it
bliss
matches
molecule.
Well,
Yeah,
that's
okay.
anandamide.
Yeah.
So THC is mimics anandamide, and that's Sanskrit for bliss. And that's what gives you those effects is what you're talking about.
Yeah.
So that reacts on CB1. Which
Do
is
those
more,
get out of balance, or are they just not
can.
receptive, like with age, or like what?
Yeah,
Okay.
the as you age, you lose more of that ability to produce your tones less. You don't have as many of your own endogenous cannabinoids, so
I'm losing
that's why.
everything.
Yeah.
Sorry, and endogenous is what you make, right? And phytocannabinoids are what the plant provides.
Exactly.
Phytocannabinoid.
Yeah, phytocannabinoids, and the main two are THC, right?
Mm-hmm.
THC mimics anandamide that you make. Then CBD is a lot like your own endocannabinoid 2-AG, and I'm not going to try to pronounce that. It's like 2-arachnoglycerol or something like that,
Nice.
so it's easier just to say
Pretty good.
2-AG. But, there's more than just those endogenous cannabinoids. We
Right.
have more, and then we have more receptors other than CB1 and CB2 scattered throughout our body. It's in every body system, which we already talked about. It's in our cells. It's on our organs. That's why cannabis is such a global therapy, really,
Right.
and such a beautiful plant and supplement. And that's why you want to work with us.
I think that if you understood cannabis the way clinicians are now beginning to understand it, like just the general population would be blown away by the amount of information that is out there, both what we have in our body and how the plant can add to that, and how they work together. It's unfathomable
Yeah.
to me. There's so much information, and we haven't even cracked the
Right.
surface yet. So
And there are clinical endocannabinoid deficiency diagnoses, and multiple
migraines,
sclerosis is one of them.
Yeah.
Yeah, IBS,
Yep.
Parkinson's. There's
Migraines.
yeah.
migraines,
Fibromyalgia.
yep, absolutely. So a lot
Wow.
of like
So
what
they've
you've
proven that we are low on our own endocannabinoids.
right.
So that's another
Wow.
reason why the plant's so beautiful.
Absolutely.
So now we are to the YouTube questions.
Okay,
so I'm going to
awesome.
be reading these, but this is a great one, I think, if there's something to it.
Okay.
So this is from Kojak the Mac, and he asks, as an ex-athlete, educate the mass on how it helps with concussions. I didn't know that. I've never heard that.
Okay.
That's a great question.
Inflammation,
Inflammation, and I think restoring those
neurogenesis.
for sure.
Mm-hmm.
So I know that
Pain.
like Megan Bang is working with tell me the guy's name.
Gilbert.
Brown
Brown.
from
Former Packer.
former Green Bay Packer, and they are doing CBD trials for concussion syndrome.
Yeah, looks
And-
good from what she was on a call that we had. When was that? A week or a couple weeks ago?
Yeah, a couple weeks.
Yeah, and she has tremendous in-depth knowledge about concussions and what the brain is doing when, when you hit your head. How we used to say, "Oh, your brain hit your skull," and
Right.
she explained a whole new way of looking at concussions, and her work is really remarkable. She's done
Agreed.
just a tremendous job
That-
around concussions.
Yeah, so that leads me to a really a question that I wanted to ask you guys is where do you go to provide resources for either patients or to other healthcare providers? Well, there's
Cannabis.
some of your great sources. So
Cannabis.
Cannabis is a really good one. That one is you have to subscribe to it, though,
Yes.
correct? So that one's not free.
No.
But
But it's nice because it's all condensed.
Yeah.
It's all cannabis research, the good and the bad.
okay, so talk a little bit more about what it is. Like,
Oh,
let's say
sure.
you went onto
It's-
Cannabis and you wanted to learn about IBS. How would that go?
So you can look up under medical condition, just type IBS. And actually, when you hit that toggle, it'll open up a list, like probably over 100 of different diagnoses.
Okay.
So you can look up the medical condition that way. You can look up terpenes. You can look up the cannabinoids, the endo, the phyto, and the synthetic, and the pharmaceutical. It has so much information. There's even treatment algorithms for insomnia and chronic pain.
Okay.
What else do you want me to add
Well,
to that? It's
so
just,
that
and
one-
it has, a synopsis of the research.
Okay.
Yeah.
So it sounds to me like that might be a good one for like health professionals because it might have more like medical jargon or things of that
True.
nature. How about just like for the average person out there that wants info on cannabis? Like what's some
think Dr.
trusted resources?
Dr. Sulek's.
Totally.
I would go to Dr. Sulek's website. He's done a tremendous job also on putting lots of information out there that's folks can understand.
Agreed.
You know, in the basics, right? Because we tend to start talking science and then we're using big words and,
Yeah.
we lose people and we understand
We
that.
do get it, yeah.
And, but yeah, Dr. What's his
Dustin
website?
Sulak.
Healer.com?
Healer.com, is it?
I'm
Yeah.
pretty sure.
so.
Okay.
And I don't know. I love books. I love the feel of books, the smell of books. So I've got a million books, and some of them are great because they're recipe books, and they're really some are very basic.
Tell me some of your favorites.
Well, I should have brought them. You know, I usually travel with my books. I can't remember.
Well, there's the Cannabis Health Index. That's probably a little more medical. Cannabis THC ratio.
Yeah, I had that one.
I have my nursing textbook too.
Yeah. We do. We read a lot of textbooks, don't
Yeah,
we?
we do.
Yeah, I'm working on, that's like, I love education and I also
Yes.
love Canva. So, if I'm stressed out, I like to go on Canva and make little patient education.
Yeah.
And so that's important to me. I like to make my own things.
One of the things that you're doing too is a publication on cannabis topics.
Oh, yeah.
So
Yeah.
talk a little bit about that, Lynn.
Oh, I'm so excited
Yeah.
about this publication. So, so we're working on, it'll go out to the community with industry experts writing about various topics. So, veterans have a section in there. The nurses have a nurse page. All kinds of industry experts. We have a home grow section where we profile home grow.
Nice.
The home growers teach us about soil, lights, compliance, insurance, legal issues. So we're just starting to work on it now. So we're really excited about it. So it's a big undertaking, and it is a joint effort. No, I'm just kidding. It's like there's
No
a
pun
lot
intended.
Yeah.
I think it was intended.
Maybe it
No,
was.
it can't be done without the help of a lot of people because, just post-COVID for myself, I don't have the bandwidth. And I'm more mature in age, than I used to be when I had my business before. So it takes a village to put something like that together. But thank you for asking about that because I'm really excited about it.
I am too, Lynn.
I love to write, and
Yeah.
so I'll get to write an article. And
One of the ways I think we legitimize us in this profession is by doing those types of things. So I appreciate the work that you're doing around that, and I love that. Thank you so much.
jumping into the unknown,
Yeah, for
it's like
sure.
reinventing yourself.
Yeah.
And but
I want to point out this excellent topic here from my good friend Chris Nielsen Portinga. She says, good discussion. Yes, we need nurse educators on this topic. Thank you. Here we are. We have a lot to do. And we always have to remember that we have to frame our education from the standpoint of someone, we just have to really kind of bring it down, and we have to meet people at their level, right? So when we go into a patient's room that's not feeling well, like we're not going to start off by, using all this medical jargon, and we're going to be like, hey, would you like to feel better? Like, what are some of the things how do you get there, So just always trying to really meet the patient where they're at. I think it's
assessing
important.
their capacity. And the one thing
Yeah.
I've really learned is there can come a time in your life or a patient's life where they lose the ability to almost advocate for themselves.
Totally.
And if they haven't slept for so long or their pain is so bad, they just really have limited capacity to understand or even hear what you're saying.
Yeah.
I just kind of once you kind of see that they're not in a place where they can learn,
Right.
and they just need to sleep, or they just need XYZ, you know, that's where nurses, we advocate for people
We
when
do.
they can't advocate for themselves.
And this is
you
a
know,
really
and-
great takeaway for people that are caregivers or that have a friend or a family member that's going through a difficult time. You can be that person's advocate, or you can be their eyes and ears as they're, you know, getting education on cannabis and kind of help walk them through that. So don't be afraid to step up to the plate, because everyone needs support. And it's a small and easy thing that you can do to get that. And at the same time, you'll be educating yourself and take that forward.
We just got a couple more that I think are good, or that I feel responsible to ask. We've got one from Brandy Bass Girl. Ooh, my kind of lady. I'm curious if you've treated any patients yet with long haul or debilitating long COVID.
Oh, that is a topic near and dear to my heart.
Okay. So first of all, we don't treat patients. We make recommendations because
Yeah.
we are nurses. But go ahead, Lynn.
Yeah, so just based on some of the studies I'm looking at and how the brain works, I'm looking at CBG with a combination of a little bit of THC and making a blend of those three cannabinoids
Okay.
and using that for long COVID. I'm just starting to look to see if there are actual studies, but I think there's some studies that are underway, but
Okay.
we don't have results yet.
Sure.
And so really, to be honest, this is such a great question,
It
because
is.
I am, like, I just keep saying there's got to be a way we can relieve patient suffering with these cannabinoids. What's the ratio? And so I actually have some chemist that we know is putting together a blend for me so that I can try it with people and just
Nice.
explore. Are you getting symptom relief? And, you know, that's always honestly the first stage of seeing,
totally is.
could we send this to an IRB study?
Yes.
You know, could we study this on a larger scale, right? So we take our best guess what we think that ratio would be, you know, based on our work with patients over time and anecdotally working with people. But I feel very strongly that we're going to see, in particular, some CBG used.
Absolutely.
You know, and probably the combination of those three, because three together that way,
Right.
you know, and then possibly with a terpene like some beta-carotene would be a good terpene to put in there too. That's
Okay.
a powerful anti-inflammatory
For
as well.
sure.
So
For sure. Love it. Great question.
Sorry, I was on mute. Let's see. And then someone asked about, Jan or Shell.
Jan Urschel.
Urschel, there you
Big
go,
ups
yeah.
to my nursing community coming through tonight.
She's-
Thank you.
She asks, why do pain management providers restrict combining marijuana with opioids? Are they really mutually exclusive?
Oh, it's a great question. I wish I knew the answer to that, because why do you do that?
I don't know why.
Yeah.
they do that.
Seems dumb.
I think that I think it's again because of the stigma, you know, that whole illicit drug.
Yeah.
Lack of knowledge.
Yeah, for
Right?
sure. I think they don't know how to use it properly or how to guide people down that road or how to start doing that thing. And like maybe cannabis in the past has been seen as like something that people are addicted to. So, you know, adding another addictive so-called property to the regimen is not something where they want to go. But I think, honestly, I think it's lack of knowledge. I think you're right.
Yeah.
I think you're spot on about that.
Yeah, and what is distressing to me is, so let's say someone comes in and they've got, they do a test, urine test, and they test positive for THC. Immediately, in some cases, the pain provider will pull the opiates.
Right.
So now, you know, and withdrawal like that, just with no warning, you know, if you've got a patient on, you know, a pretty, you know, substantial dose of
Right.
opiates and you just stop it immediately, it's,
They're miserable.
Yeah, it's not good.
It's actually dangerous. It's life-threatening, honestly. If you're on opioids, you need to titrate off your opioids. And management of symptoms from that process can be alleviated with cannabis. So, I mean, they really do need to be looking at that, and I think there's people out there that have a real passion for that. So big ups to them, and please keep doing that work. But it's something that shouldn't be taken lightly, because when you talk about decreasing people's opioids, I mean, your body becomes dependent on it. It actually is life-threatening when you stop opioids suddenly. That's why you see, like heroin users becoming really, really sick. And, it's a life-threatening medical condition, withdrawal is, from opioids. So certainly cannabis can help alleviate those symptoms,
Same
I believe.
with alcohol.
Same with
Withdrawal can kill
alcohol.
you, too.
You're absolutely right. You're absolutely right.
All right, last one. We've got Jan again, but I think it's a great question, which is, where do you get suppositories? And then I'll ask, where do they go? No.
Well, they can go vaginally or in your anus. So that's to answer that question.
Penis hole. Okay, no, that's good.
And then where can you get them? Geez. Well,
I would say until we have some of these made here in Minnesota, probably the best place to get them would be Trusted Cannabis
Nurse, yeah. So we can post some links on the YouTube channel after the show is done airing of some trusted places where you can kind of source things like that, Jan, if you're interested. Anything else, Gabe? Any other questions?
We are all good. The butterflies are flying. It's all good.
We have lost our screen.
Oh, you have? Oh,
inside
okay.
here,
Timed out.
So, yeah.
I did
Yeah,
see
we've been
some
on for
questions
2
come
hours,
up on the
so.
screen.
Okay.
Oh my gosh.
Any last thoughts, girls, that you want my audience to know?
Yeah, we're here to help and help you on your journey to health and wellness and a higher quality of life. And I'm here to help you do it in a harm reduction, low risk, and I'd be happy to help you.
Yeah.
So,
Great. And you, Lynn?
Yeah, same. Just love connecting with people, and I want to be resource guide, and however I can help. Also, any nurses wanting to start businesses
Absolutely.
too. Don't forget, I love doing that too.
Yeah.
And
Lynn's been super helpful.
And to the healthcare providers, to the people that are prescribing, things, doctors, PAs, nurse practitioners, reach out to us. Reach out to the cannabis nurses if you have questions or concerns or have a specific patient that you kind of want to talk about. We're here for you. So.
Yeah.
Yeah.
Oh, and I do offer a free 25-minute discovery call, too.
Okay,
so
nice.
that if anybody wants to throw something at me and see if we're a fit, or I'll have a little information for you before we do that call. You just send me your questions back. So, yeah.
Perfect.
It's a great way to kind of see if it's going to be a good fit.
Awesome.
Yeah.
Well, thank you, girls. Thank you so much for coming out today. Thank you for allowing my audience to be engaged and answering their questions. So that's it for the show tonight. Conversations with Kush podcast, and I'm Molly the Kush RN signing off.
Thank you, Molly.
Thank you.
Thank you.
Thanks, guys. Great show.
Sorry we talked so long.
Yeah, we did.
Ooh, years.